In hospitals around the country, a growing concern. A fungus that has already infected at least 587 people in the U.S., more than 300 in New York State, including some at Brooklyn's Mount Sinai.
When did you first see it at this hospital?
We saw a cluster of patients develop in 2016. And that's really when the outbreak began, particularly in New York and Brooklyn region.
The fungus is a form of the very common Candida, which is easily treated. But this strand, called Candida auris, is stubborn. 90% of cases are resistant to at least one antifungal medication. 30% are resistant to 2 or more.
The aha moment we had was when a patient died with it, and we did cultures all over the room. We found that the Candida auris was everywhere.
When you say everywhere, what do you mean?
We found it from top to bottom, from the ceiling to the wall monitors, to the artificial respirators, to the pumps, to the bed, to the floors.
The patient who contracted the fungus died after 90 days.
This doesn't affect healthy people at home. It preys on those that are immunocompromised with chronic health conditions.
The infection, which causes fever and chills, enters into the bloodstream most likely through medical equipment.
If you connect it to our artificial respirator, then it has a portal to get into the lungs. If you have a central venous catheter, it has a portal to get into the bloodstream.
The only way to keep patients from getting it is to make sure rooms are spotless. At hospitals like Mount Sinai, where there hasn't been a case since May of last year, there are now strict procedures, including a special gel to ensure every corner of a room has been scrubbed.
You can see that if this still existed, this area was not cleaned.
After that, large UV lamps are used, so powerful no one can be in the room when they are on. The CDC says the fungus has been found worldwide, from the U.S. to South Africa to India, and becomes resistant to treatment quickly. While it is not a threat to the general public, hospitals and nursing homes have to stay vigilant. For the very sick, their lives are at stake.
One other troubling characteristic, Candida auris is difficult to detect, but experts say they're already working on better ways to test for it. The next step, trying to figure out the best way to treat it, guys.
Wow.
Very disturbing. Thank you so much.
We're going to bring in NBC News medical correspondent Dr. John Torres. Dr. John, when you listen to Steph's piece, you get kind of scared and creeped out a little. How worried should people be if they're either in the hospital or have a family or friend who is?
And right now, this Candida is basically isolated to people who are in the hospital. They've been there for a long time. They're sick. They have compromised immune systems. And so people should be aware this is going on, especially if they have a loved one in the hospital or they themselves have to go in the hospital. But it's not time for panic. This is not taking over the world. This did get discovered in 2009, so it's a new fungus we discovered, and all of a sudden it's cropped up around the world. So it has experts concerned and looking into it and making sure it doesn't take that next leap where it starts affecting healthy people.
So as Stephanie was reporting, it apparently is very hard to detect and hard to kill and can be from like floor to rafters in a hospital room. Is it then contagious? I mean, is that something you get concerned that hospital workers will get and then they go out into the communities? Is it easily contagious?
It's contagious and it can be carried from person to person. But again, right now it's only affecting sick people who have compromised immune systems. They're hoping it doesn't make that change to affect people who don't have compromised immune systems. And it's hardy. It can last for weeks on surfaces. So cleaning it's important. But again, so far it's isolated to hospitals and nursing homes.
But how do you get it? Like, how do you get,
Well, it's the same way you get any kind of fungus or bacteria. It spreads like that. And the concerning thing about this one is most funguses, you really need contact or close contact in order to get it. This one's acting more like a bacteria, and it's actually staying on the outside of the body.
So if I touch something where it lives, could I get it?
Exactly. You touch something where it lives, it can get on your hand, and then if you touch somebody else, it could get on them. And that's why one of the important messages they're giving across, which we repeat time and time again with a lot of things, but it's important for this one, is hand washing.
That's it. Just wash your hands.
Wash your hands. Make sure that the staff, before they touch anybody that's in the hospital, has washed their hands. And it's okay to ask them, did you wash your hands? Can I watch you wash your hands before you touch somebody? Make sure the equipment itself has been cleaned. You can ask them about that. And ask them, if you have somebody in the hospital or going to the hospital, have they had a problem with Candida? Have they cleaned it? What have they done? Are they using special cleaners? And like Stephanie said, the UV lights. And
what about those hand sanitizers?
So the alcohol, I talked to the CDC yesterday, and they said the alcohol gel sanitizers work really well. Those do a great job of getting rid of the Candida. The soap ones, the one you look at that are antibacterial, those don't do that good of a job. 20-second hand washing is the best thing you can do.
Dr. Joe.
Dr. Torres, thank you.
You bet.
Thank you so much.
And you too, Steph.